Hello, my name is Zarina and I'm going to present stroke. So I'm going to talk about the stroke as a public health problem, the cause of the stroke, prevalence and incidence, risk factors, public health nurse interventions, eliminating and mitigating risk factors, call to action, and references at the end. So, stroke is a significant public health problem characterized by the sudden interruption of the blood flow to the brain, leading to brain cell damage and potentially life-threatening consequences. There are two main types of stroke: ischemic, caused by a blockage in the blood vessel supply, and hemorrhagic stroke, caused by bleeding into the brain. The interruption of blood flow deprives brain cells of oxygen and vital nutrients, leading to their rapid deterioration and death. Depending on the location and severity of the stroke, this can result in various physical, cognitive, and emotional impairment. Common consequences of stroke include paralysis or weakness on one side or both, difficulty speaking or understanding speech, vision problems, memory loss, change in behavior or mood. Prevention and intervention public health initiatives targeting risk factors reduction and promoting of health lifestyle. Awareness campaigns about stroke signs and symptoms, and prompts access to emergency medical care for better outcomes. The costs of stroke to the healthcare system and society are significant and multifaceted. While the exact figures may vary depending on factors such as healthcare systems, country, and methodologies used in calculations, numerous studies have highlighted the considerable economic burden associated with a stroke. Here are some key points regarding the cost. So, direct healthcare cost. Strokes requires immediate medical attention, hospitalization, diagnostic tests, treatment, and long-term care. The expenses associated with these healthcare services can be substantial. According to AHA, it can be $30.6 billion. And indirect cost. These include productivity losses due to disability, premature death, and absenteeism from work for stroke survivors and their caregivers. The need for caregiving and support services also contributed to indirect cost, which is $20.7 billion. Also, it can include the rehabilitation of long-term care and economic impact. If you can see on this slideshow, so the geographic location strokes occur worldwide, but the prevalence varies by region. Urban areas may have higher rates of stroke due to the lifestyle factors such as sedentary behavior, unhealthy diets, and pollution. Healthcare access. Access to healthcare services plays a crucial role in stroke outcomes. Regions with limited access to healthcare may have higher rates of stroke-related mortality and disability. Time of the day. Stroke can occur at any time, but there's a higher incidence in the early morning hours, possibly due to changes in blood pressure and other physiological factors during sleep. And seasonal variation. Some studies suggest that there may be seasonal variation in stroke incidence, with a higher rates observed during colder months. If you can see on the left table the ages, so there are over 12.2 million new strokes each year globally, and 1 in 4 people over age of 25 will have a stroke in their lifetime. And the Black adults are 45% more likely to die from the stroke. Major risk factors is hypertension, smoking, diabetes, high cholesterol, physical inactivity, obesity, and overweight. Excessive alcohol consumption. The thing is, if you can see the major risk factors, they're all modifiable. So we can teach all the patients and population that we can prevent the stroke. We have protective factors for the stroke. It's regular physical activity, healthy diet, moderate alcohol consumption, blood pressure control, managing diabetes, and cholesterol management. Public health nurse intervention. I chose three of them: health teaching, case management, and surveillance. The one that I chose is surveillance intervention for stroke. Implementing a stroke surveillance program within a community healthcare system to monitor and track the incidence and prevalence of stroke cases. This intervention involves systematically collecting, analyzing, and interpreting data on stroke occurrences, identifying trends and risk factors, and implementing targeted interventions to prevent strokes and improve outcomes for stroke survivors. Best practice approach for stroke surveillance may include establishing standardized protocols for stroke case identification and reporting, utilizing electronic health records and data registries for comprehensive data collection and analysis, collaborating with the stroke centers and emergency departments to ensure timely and accurate reporting, and implementing evidence-based strategies for stroke prevention and management based on surveillance findings. This interventions aims to enhance stroke awareness, early detection, and intervention efforts, ultimately reducing the burden of stroke of individuals and communities. Eliminating and mitigating risk factors. Hypertension management. Public health nursing intervention can focus on hypertension management as high blood pressure is a leading risk factor for stroke. This may involve community-wide education campaigns to raise awareness about the importance of blood pressure control, promoting regular blood pressure screenings in community such as clinics, pharmacies, and workplaces, and providing access to the culturally tailored hypertension management programs. Smoking cessation. Smoking is another significant risk factor for stroke. Public health nursing intervention can include the implementation of smoking cessation programs that offer counseling, behavioral support, and pharmacotherapy to individuals who cannot quit. Physical activity promotion. Lack of physical activity is associated with an increased risk of stroke. So we can focus on promoting physical activity through community-wide initiatives such as walking clubs, exercise classes, and recreational programs. Nutrition education. Poor diet, including high consumption of sodium, saturated fats, and processed foods, is modifiable risk factor for stroke. Public health nurse intervention can involve nutrition education programs that promote healthy eating habits, such as consuming a diet rich in fruits, vegetables, whole grains, and lean proteins, while limiting intake of sodium, trans fat, and sugary beverage. And chronic disease management. Chronic disease such as diabetes, atrial fibrillation, and hyperlipidemia are significant risk factors. So, if we modify lifestyle and coordinate the care, we can work with the chronic conditions and optimize disease control. Call to action. So, we need to know the risk factors. So, we need to educate yourself and others about the modifiable risk factors for stroke, including high blood pressure, smoking, diabetes, obesity, and physical inactivity. Awareness is the first step toward prevention. Burden on families. We need to adopt healthy lifestyle habits, make lifestyle changes to reduce your risk of stroke, such as maintaining healthy diet, engaging in regular physical activity, quitting smoking, moderating alcohol consumption, and managing stress. And economic cost. Seek regular care. So attend regular checkups with your healthcare provider to monitor and manage chronic conditions such as high blood pressure, diabetes, and high cholesterol. Early detection and treatment of this condition can significantly reduce risk of stroke. As we reflect on the critical importance of stroke prevention, I urge every one of you to take meaningful action to help address these pressing public health issues. We cannot afford to stand idly while stroke continues to devastate lives and communities. It is time to come together and make a difference. So we need to spread the awareness, support community efforts, advocate for policy change, lead by example, and stay informed and engaged. So together we have the power to make difference and fight against a stroke. And here's the reference that I utilized while preparing the slideshow. Thank you.